I'm presenting to my preceptor, Mrs. Brooks, about a patient that came in complaining of my baby was born November the 7th, and my arms and legs are still swollen, and I'm sad. RW, she's a 26-year-old African American female who has had three pregnancy, para 1, gravida 1. She presented with worsened generalized edema since giving birth in November. Her medical history includes gestational diabetes mellitus, preeclampsia. During her recent pregnancy, she experienced complication preterm premature ruptured membrane, leading to a vaginal delivery at 33 weeks. The patient states that she does not breastfeed, and upon examination, her vital signs were stable, but she exhibits generalized edema and reduced breath sounds in the base of her lungs. I ordered some labs on her. I ordered an EKG and a urine specimen. She denies any pain or discomfort. The past medical history is she had childhood asthma. She has delivered vaginal 3 times. Her immunization and her flu shots are not up to date. She has not had a mammogram nor a colonoscopy. Her last visit to the clinic was in November 2002. She's not allergic to anything. She's not allergic to any foods or environmental allergies. The only medication she takes is ibuprofen 200 milligrams as needed for pain, Tylenol 250 milligrams as needed for pain. Her family history is her mother died in her sleep at the age of 30. Her father has hypertension and is a IV drug user. Her grandmother has hypertension, and her grandfather has diabetes and hypertension. RW is 26 years old. She's homeless. She resides at the Providence House in Shreveport, Louisiana, living with her 3 kids. She is experiencing limited hand and legs movement, which hinder her to perform her activity of daily living. During her clinical visit, she accidentally spilled a cup of water and explained that she was unable to hold it in her hand due to her weakness. Her review of her system, she denies any fever, malaise, fatigue. She denies any weight loss, but she did state she gained 10 pounds. She denies any appetite changes. She denies any sore throats or difficult swallowing, any nasal drainage, any headaches. She did state that she sees floaters and her vision is changing. She denies any chest pains, any palpitations, any shortness of breath or wheezing. She did state she had a non productive cough for 2 weeks. She denies any nausea, vomiting, diarrhea, any constipation or bloating. Her last bowel movement was yesterday and it was normal. She has positive muscle weakness. She has tingles in her fingers and her hand. She has 3+ edema in her upper and lower extremities. She denies any syncope. She denies any suicidal thoughts, anxiety, but she do complain of depression and mood swing. She's alert and oriented. She denies any rashes on her body, any hair loss. Her skin is dry and tight. She denies any bruising or bleeding. Her vital signs are her height is 5'4". She weighs 297 pounds. Her BMI is 30.7. Her blood pressure is 143/92. Her heart rate is 20. Her respiration is 20. Her heart rate is 116. And she's afebrile of a 98.0 Fahrenheit. Uh, the three differentials that I came up with was peripartum cardiomyopathy. That's my first one. My second one is DVT. And my third one is lymphedema. The positive with pericardium cardiomyopathy is dyspnea, tachycardia, diminished lung sounds, and peripheral edema. And the reason my final diagnosis is pericardium cardiomyopathy. And the reason I chose that is because PPCM is a diagnosis of exclusion in women presenting with heart failure due to left ventricle systolic dysfunction and should be considered when no other cause is evidence. PPCM has evidence defined as systematic heart failure presenting in the last month of pregnancy and up to 5 months postpartum. However, the definition has been broadened because women who present prior to the last month of gestation was found to be clinical unable to identify from patients with classified defined PPM. So my that was my final diagnosis, and my plans is we we're going to arrange for her to get transported to the emergency center, Ochsner Hospital, for evaluation. We're going to send over the EKG, which had a sinus rhythm on her EKG. We got a CBC, a CMP. We did some cardiac enzymes. We had a negative troponin. Her BNP was 674. She had a negative D dimer. Her chest X-ray showed mild bilateral interstitial edema, suggesting pulmonary edema. Her echo revealed mild evaluation elevated left ventricle pressure. Her EF was 55 to 60%. We're going to start her on a diuretic, Lasix. We're going to start her on a beta blocker, metoprolol twice a day, leading to the improvement of her symptoms. And we're going to transfer her to the emergency room to get evaluated. Follow up. I'm going to follow up with her in 1 to 2 days to see her status, to see how is everything's going on. According to the Newman model piece, they had strong emphasis on considering the full individual. So her physiological interpersonal was decreased physical activity, swelling and weakness. Her interpersonal was not a good relationship with her family. She's homeless. Her extrapersonal was insurance and she's on Medicaid. Her psychological interpersonal was depression and suicide. Her interpersonal was not a good family support, homeless, and she lives in a homeless shelter with her 3 kids. Extrapersonal is not a good family uh, relationship, and she's worried about her 3 kids. Social culture, she lives in a homeless shelter. Um, Interpersonal, she the staff member helps her with her kids and no family support. Extra personal, she has no good healthy environment. Development, she has sleep disturbance due to her depression. Interpersonal, she has become limited movement of her hands and her feet due to her condition. Extra personal, she had decreased physical function. Spiritual, she do believe in God. She does not attend church. And extra personal, she has access of Sunday school at the Providence House. Like I said, I will follow up with Mrs. RW in 1 to 2 days to reschedule her an appointment here at the clinic to see what the hospital has stated. Thank you.